Joining us right now to provide context and a deeper understanding of this is Dr. Andrew Jamison, the Division Chief of Infectious Disease and Regional Medical Director of Infection Prevention at Mercy Health. Dr. Jamison, thank you for taking time tonight. I do want to dive right in while we have you. What's your response to the development?
You know, I think like everyone else, I'm very concerned and it worries me. But at the same time, I'm actually encouraged by this. This tells us that the system is working and that we have the ability to quickly recognize things that we want to get more information about. So it's an odd combination of both worried and wanting to know what's going on, but also reassured that the system works.
And I am a numbers person. I know others at home are as well. So when we see that 6 people are impacted, having this adverse reaction out of nearly 7 million, some may feel like this is a small amount when we know that the vast majority are doing okay. So what do you make of that?
No, I think you're exactly right. You know, the numbers are very rare, and I think that should be encouraging for everyone, and I think that that should give some context that this is unlikely to happen to them. But I think the severity of the complication is what really is catching the attention of regulators, and that's really what's catching the attention of the clinicians that are watching this as well. We want to make sure that nothing like this happens, and if there is a very small chance of this, that we understand how to recognize it and how to treat it quickly.
Now, I was in touch with health departments throughout the day today. For those that have Johnson & Johnson clinics set up, they're just swapping them out with Moderna or Pfizer so people can maintain their appointments. Are any Mercy Health clinics impacted by the pause?
Yeah, we have been using Johnson & Johnson. So we've been using it in the inpatient setting. So we actually are vaccinating people that are admitted for minor reasons. We're also using it in a pharmacy that's on site for us. And then we're using it in some of our outpatient clinics. So it definitely took a little bit of juggling today. We did cancel a couple appointments for people, but our clinics that are reaching some of the most vulnerable and our clinics that are trying to get access to people getting vaccinated are still running as scheduled. So no one that had an appointment had an appointment scheduled or had an appointment canceled that they couldn't get another vaccine. So we just swatched out for Moderna or Pfizer and are keeping on vaccinating.
Okay, and we know that we don't have a timeline for how long this pause will actually last, but can you explain a bit about what the advisory committee is going to be doing during their own review on it?
Yeah, so because this complication is very similar to what happened with some of the AstraZeneca patients in Europe, and there was a recent study from both Norway and Germany that can describe some of this. What the regulators are going to look at is those cases, look at how they compare to the ones we have with Johnson & Johnson because the vaccines work in similar fashion, and then determine what is the best step for recommendations. My suspicion is they're going to give us some recommendations as clinicians to perhaps avoid vaccination with Johnson & Johnson in certain age groups or with certain medical problems, or they might just give us the go-ahead to go back. I do suspect this will happen relatively quickly. I don't think this is going to be a long pause.
So is it safe to say that you think people can get back to those Johnson & Johnson appointments eventually, or could we see this removed as an option?
I doubt this is going to be removed as an option overall, because what you mentioned was that it was a very low risk of this disease and a very small chance of this outcome. Interestingly, the chance of this happening, 6 out of about 7 million is actually lower odds than this happening just in the general population. So this is a rare disease by itself, but I think we just caught our attention with how fast it happened after a vaccine, and also the relationship with AstraZeneca really caught the eye of the FDA and the CDC. I doubt that this will be pulled completely, and I think that we will be getting back to using it.
Okay, and last question for you. What's the message to folks who see this and are feeling more anxiety about getting vaccinated?
I mean, I think the message is that the system works. You know, we have the ability to quickly capture concerning trends and address them. And we know that we've had great response and we've had a very safe rollout of Pfizer and Moderna, and keep on getting that vaccine because that's our best way of getting out of this. But we have a lot of transparency here from the FDA and the CDC, and I take a lot of confidence in that and look forward to the recommendation soon.
All right, Dr. Jamison, your insight has been so appreciated throughout this rollout, but especially tonight. Thank you for making time.
Thank you.